My daughter was a normal 6th grader who ate hot lunch in the cafeteria every day. However, soon after she ate, she would start to feel sick. She would either have a stomach ache or a headache and even throw up. She thought that she was getting sick from the stress of school. I went along with her reasons for feeling sick for a little while. She kept having stomach aches and headaches, especially after she ate, and she kept throwing up after she ate. Then I felt it was time for her to see our family doctor. I made an appointment for her to see our pediatrician. The pediatrician examined her, but didn't seem too worried about my daughter, and he agreed with her that he thought it was the stress of school causing her to feel sick. I think that he really didn't know what it was and didn't really want to probe further to find out what it was. I started talking to friends and relatives about my daughter, and my brother-in-law suggested we talk to a naturopathic doctor, a friend of his, Dr. Wang, out of California, where he lived. We set up a phone consultation with her, and we talked on the phone with her for about an hour and a half, where she asked us all sorts of questions that the other doctor didn't even ask, and she probed really deep. She put the pieces together for us and suggested that my daughter was celiac. My daughter had some classic symptoms of being celiac. She had growth problems. She was very small for her age, decreased appetite and failure to gain weight. She had very little appetite. Chronic diarrhea is another symptom, chronic constipation, vomiting, which she had. Also, you could have abdominal bloating and pain. She had some bloating. You could have fatigue and irritability. She was irritable at times. There are other symptoms you could have, like behavioral symptoms like ADD and anxiety. She had ADD. You could have skin symptoms like acne or brittle nails. She had acne. Miscellaneous symptoms like asthma and bladder infections. She had asthma off and on as a child. You could have oral symptoms like bad breath and gum disease. Thank God she didn't have any of those symptoms. You could have intestinal symptoms like acid reflux. She didn't have that either. You could have joint and muscular symptoms, which she didn't have any of those. You could have vitamin deficiencies like low calcium, low vitamin B12, which she did have because Dr. Wang did test for that. So she had a lot of classic symptoms of being celiac. But the only real way to test for being celiac is by doing a biopsy of the intestine. At the age of 12, we scheduled this to be done. My daughter had it done, and the results of the biopsy showed that she was definitely celiac. So now we had our diagnosis. And with this diagnosis, we had lots of questions for the doctor. The main question for her was, what can I eat? Other questions she had were, what does it mean to be gluten-free? What exactly is gluten? What does it mean to be celiac? We had all sorts of questions. The questions seemed never-ending. My big question was, how is it going to affect her lifestyle and also the lifestyle of our family? Being gluten-free means not being able to digest gluten, which is a protein found in grains, such as wheat, barley, and rye. Gluten is also hidden in many products, and you need to read labels to make sure that something is truly gluten-free. We look at all labels just to make sure everything is truly gluten-free. For example, licorice. Licorice has wheat in it. It's a filler. Hot dogs have wheat in it. It's also a filler. So reading labels is very important when trying to have a gluten-free diet. Also make sure that what you're buying is not produced in a plant that contains wheat. That could also have an effect on you. So reading labels is very important. The big question my daughter had was, what can I eat and will I be able to eat like other kids? You know, she's still a kid herself. Living a gluten-free lifestyle is not easy, but it's also not hard. There are many companies that make gluten-free alternatives that taste good. There are also many restaurants that have gluten-free menus and gluten-free choices. Eating gluten-free can be as simple as having a piece of grilled chicken or a salad with no croutons. It can be a hamburger without a bun. It's really not that hard. But eating gluten-free in social situations is a whole different story. Most people only think about the diet aspect of going gluten-free, but not the social aspect as well. Food is involved in almost any social get-together, especially for teenage girls. My daughter tells friends and relatives that she can't have gluten, or she brings her own food. We found that most people are understanding if you just tell them about your needs. Either way, gluten-free is going to be a lifestyle change for you. There is no cure for celiac disease. The only treatment is a gluten-free diet. Celiac patients vary in their tolerance to gluten. Some patients can ingest small amounts and feel fine, while others can ingest a small amount and feel sick. My daughter can ingest a small amount at this time and feel fine. The standard treatment, though, calls for complete avoidance of gluten for life. My daughter will have to avoid gluten for the rest of her life. Things that have gluten in it are like breads, cereals, pasta, crackers, cakes, cookies, gravies, pizza. Pizza's in every social situation you could think of. Also oats. Oats can be contaminated by wheat, so you have to avoid oats. Processed foods also contain gluten because wheat is used as a filler in many processed foods. So once again, you need to read your labels. You can still enjoy eating food being gluten-free. My daughter has been gluten-free for over 4 years, and gluten-free food is as good or is better than regular gluten food. People assume that going gluten-free means they can never enjoy food again, which isn't true at all. In fact, going gluten-free allows you to enjoy food more. You will eat without getting sick, and you will enjoy your food. Luckily, there are gluten-free alternatives to pretty much anything now. You can still enjoy food as long as you're open-minded and realize there are many options for you to enjoy. My daughter is much happier and much healthier on a gluten-free diet, and you can be too.